Let's get started with questions.
Doctor, is it safe to go trick-or-treating?
Are you going to force people to get tested?
Paul, go ahead. Is it safe to go trick-or-treating?
We want people to think of more creative ways to celebrate Halloween. There are options that people can do with kids, get them costumes, allow them to have bowls of candy throughout their house, do Zooms and other ways to engage. With that being said, we're going to be back tomorrow with other safe ways to allow kids to celebrate some of this, but to pay attention to what we're seeing with the numbers and make sure that we are monitoring that carefully.
Does that mean no trick-or-treating?
We'll be back tomorrow with more details.
Governor, did you say that you're going to be tested weekly?
Yes.
And what prompted that change? How often have you been tested until now? And we know you were tested after you said that you were tested after the protest in June. How many times have you been tested through this?
So I've been tested 3 times, and we're going to start this week on a weekly cadence because that's what the doctor recommends. And it's part of a greater effort. I know I feel fine. I have no symptoms. I'm extremely careful. But it's part of what we're talking about with more asymptomatic testing. So I'm trying to lead by example. And also it was recommended that public leaders consider having more testing given the positions that we're in.
Governor, you said mandatory. Just to follow up on that, if I might, do you think that everyday people should be tested frequently, asymptomatic testing?
Yes. So we're going to come out, again, we're going to come out next week, hopefully early in the week, if not by Wednesday, with a new system of mandatory testing for asymptomatic people. It doesn't mean every Rhode Islander is going to have to get tested every week. That would be impractical, not that useful, and incredibly expensive. But like when we talked to Dr. Birx, she said, what about if you test, for example, all commuters to CCRI and RIC on a regular basis? Like what we're trying to do is test enough asymptomatic Rhode Islanders frequently enough so we get a feel for where the community spread is. So that's what we're trying to figure out.
Governor, you're saying mandatory testing of asymptomatic people. Are you going to force people to get tested who don't want to be tested? That's what people are hearing. And how can you do that?
We can't really. You can't. You offer it. It's like I was saying to Steve, I would never suggest that everybody have to get tested every week, as I am going to be. But just it's exactly what we've been doing in nursing homes for months, which is working. We offer it to every resident and every worker in every nursing home on a regular basis. So no, you can never force anybody, and we would never try to do that. But we would offer it, we would make it free, we would make it easy, and we would do it on a regular basis.
We're talking like teachers?
Maybe. We're still figuring it out. Maybe.
And along the civil liberties front.
And the reason for this is you don't want to have just the worried well, right? You want the worried well. Like in other words, people who on their own choose to go get tested, that's a great thing. So today I'm asking you, go to portal.ri.gov and go get tested. If you're a teacher, if you're a hairdresser, if you had a party last weekend, go get tested. But we want to try to have more systematic testing, just like we've done in nursing homes, of enough people in Rhode Island so we get an accurate picture of how much virus there is in the community. Does that make sense?
On kind of the civil liberties thing, and I know tomorrow you're going to have more announcements, but you're pinpointing small family get-togethers, people with friends. How do you enforce that? And people are thinking, like, are the cops going to show up now if you go to your mom's house to go have dinner? I mean, how do you realistically enforce rules on small gatherings,
Yeah.
if you're just going to visit a friend.
Yeah, I shouldn't laugh because it's serious, although I had an image in my head. We're not going to do that. We are not going to send the cops to people's house. I'm going to ask people to do the right thing, and I'm going to have faith that they're going to do it. And I think that they will, because that's how we've gotten to where we are. I don't think anybody's trying to be malicious. I think everybody's just gotten too relaxed. Having said that, and I'll be back tomorrow, big parties, Halloween parties, big social gatherings, bars that don't close and allow congregating, there will be enforcement for that.
Governor, you mentioned that hospitals had expressed to you that they're concerned. Are we at the beginning of the second wave here in Rhode Island? And it kind of feels like we're back in the spring as far as the tone of this press conference today. So what are the new metrics, the new trigger points that will possibly set us back into phase 2, have some sort of relapse into a lockdown? What are you hearing from inside the medical community about the status quo and where we're headed?
So there'll be no new metrics. You know, we've spent a lot of time on our data, and these are the metrics we're going to follow. Test positive, cases per 100,000, hospitalizations. We know what we're doing. It is not the spring. It is not the spring. We're testing 10, 11, 12, 13,000 people a day. We know how to, we have hundreds of people doing contact tracing. We are, you know, honestly, I feel concerned about the data, but I feel very good about our systems because we have the data. Like she said, she's done case investigations for 1,000 people in a week. We have a good handle on our problem right now. We didn't have that in the spring. In the spring, we didn't know where the virus was, how much virus there was. We have a handle on our problem. Our problem is these unstructured, informal social gatherings with people who you know, and we are not following the rules. So we are not going to go back a phase. There's nothing in this data that makes me think we have to. What I'm here saying is, if we don't change, then we'll go back a phase. Look, if in a month from now, people haven't heeded our warning and we look like Wisconsin, then we'll go back a phase. But why will that happen? To Brian's question, like, everybody, come on, listen up, make a change, do the right thing, flatten the curve so we can keep going to work.
Are we still seeing the same trends with respect to congregate care settings, particular zip codes, et cetera, in the state that we saw in the spring, or are we now to the point where that's not reflective of the status quo?
That is not. In fact, if you look at this slide, which was up on the screen, things are looking pretty good in congregate care. You know, it's actually declining in congregate. It's very sad because too many deaths are resulting because these are vulnerable people. So I don't mean they're looking pretty good. What I mean is we're testing regularly, we're isolating, we have it under control in congregate care. We have it under control in K through 12. We're getting under control in colleges, not quite there yet. We have like broad community spread in the community, and so that's why we have to do more testing to figure out where are sick people and getting asymptomatic people into isolation. That's our problem right now. People who have the virus, who don't feel sick, who aren't taking any precautions, and they're getting others sick.
Governor, good afternoon.
Hello.
Shifting gears a little bit, you've distributed just over 20% of the aid for small businesses, and I know Stephen Pryor is moving into a position here. Would you consider that 20% a successful program so far? Over 8 weeks, only 20% going out?
I would say it's 1,400 businesses, and for them, it's a success because we've heard from them, thank you, we'd be closed otherwise. It's not as fast as I would have hoped. I would have liked to have seen it faster, which is why today we announced an expansion of that initiative, Restore RI? Yes, yeah, I lose track of all the names. Restore RI, we're going to double the amount that businesses can be eligible for. We've expanded it to sole proprietors, expanded it to child care, and we're expanding to nonprofits. So is it a success? I'd judge it an incomplete. It's a good beginning, but there's more to do, and I wish it were going faster.
So it's been 8 to 10 weeks since you announced that in the application process. You got 11 weeks till the end of the year. And that coronavirus money sitting in an account right now. And you've been telling us for 5 months that you hope that Congress will, in your words, do the right thing.
Yeah.
They haven't done so far. The House isn't even in session. The Senate's preoccupied. And if the Republicans do lose the Senate, if Mitch McConnell for some reason loses it, I don't think they're going to be in a mood to give the Democrats what they want. So under that total picture, first of all, are you confident that you're going to be able to get more money out the door of what you allocated? And why not consider putting more out the door now? What if you lose that money at the end of the year? You've been sitting on it. It's got to be used, and Congress does not act.
Yeah, you're asking all the right questions, which is what makes my job tough right now, because I'm trying to balance all of these interests in a sea of uncertainty. You know, I talked a week ago to our congressional delegation and the Treasury Secretary, who are feeling reasonably confident that the year-end deadline will be extended. Reasonably confident that we're going to have to use some of our coronavirus relief to balance our budget. I don't have a crystal ball. I do know businesses are suffering, so we put more money out today, and we're going to work like crazy to get all that money out to the businesses that need it. The election is a few weeks away. We'll see what happens. We're not going to give the money back. I'll tell you that. We will figure out a way to get the money into the hands of Rhode Islanders by the end of the year, if that's what I need to do.
Just one final follow-up. I heard from a wedding planner in Newport, and this industry has just been decimated. Yeah. And she got $4,200 out of a potential maximum $15,000. She's lost tens of thousands of dollars. Yeah. So you have put out the call, be creative. They've talked about Connecticut, Massachusetts are 100 people. They're limited to 50 indoors. They want to know, and I know despite these numbers that are coming out today, they're already planning for 2021. They're talking about possibility, what about going up to 100, it's a controlled setting, and doing testing 72 hours in advance of the guests coming in. Mm-hmm. So they want to have that dialogue with you, and what they heard last week when you said that vaccine is what really set them off. Because what they heard from you is, I don't think we're going to be able to move to larger numbers until maybe we have a vaccine. So can you speak to that, to that industry?
Mm-hmm, definitely. And by the way, we're trying to engage with the industry, and I'm going to actually be spending more time myself talking to people, because I hear from them, but I want to have like a structured way to hear what's going on in people's lives. What I referenced, I was thinking more like the convention center. So big gatherings. Not a 100-person wedding. I cannot, in the position we're in right now, in light of the numbers I just went through, contemplate any expansions for indoors. But it doesn't mean we won't at some point, certainly before a vaccine.
Well, what about that with potential testing? And
it's a controlled
It's
actually a good idea. Give me the good ideas. Every good idea. You've given me a few. They're not yours, they're other people's, but the voice that you give them, and we've pretty much followed up. So, you know, we'll think about it.
Governor, let's elaborate on that point for a second. When you talked last week about vaccine, I think the words were something to the effect of not a silver bullet.
Yeah.
When you combine that with statements that have come out of your media office about a holistic approach to testing and an evaluation of where we stand in light of today's crisis, and when you add to that organizations none other than WHO have come out and advocated for stepping away from these type of lockdowns that we're still to a degree involved in right now. When will the governor's office decide on a standard that will essentially end these type of lockdowns? People see this right now. We've gone from flattening the curve to an elongated, murky process that may never end.
So we don't have a lockdown. 90% of our economy is going. We can go out for dinner. People are largely going to work. Our kids are largely going to school. The restriction, to be clear, is, you know, Hummel and I were just discussing. I know there's restrictions, and I know that's hurting people's pocketbook, and I'm sorry about that. But we're not in a lockdown. What we're in is a reasonable, targeted set of restrictions that are narrowly tailored and designed to save people's lives. And actually save people's jobs, because if we were to get into the Wisconsin, South Dakota, North Dakota territory, more people would be out of work. So it's not a lockdown, and I think they're a reasonable set of restrictions.
Having been raised Catholic, I'll use the term purgatory. We're not in a lockdown, you're right, but we're also not in a position right now where businesses can reasonably expect to attain a profit if they're anywhere near the hospitality space. And given Rhode Island's economy heavily leveraged towards healthcare and the hospitality space,
Yeah.
we might as well be in a lockdown for some businesses.
So, no, I would say two things. Purgatory is on the way to heaven. So, going along with your analogy, we're going to keep going with that, and it's better than the alternative. So let's keep going. Let's do the right thing, follow the rules, and get ourselves to the right place. And that's precisely why we're putting out more commerce relief today, which I didn't have time to go into. Some of it is specifically targeted at hospitality and hotels, because we know they're most struggling. Some of it is specifically targeted at culture and arts, and we just put it out today, so, because I know they're struggling, and you're right, we got to get it out the door.
Governor, can you explain again why Wisconsin is being used as the model? Simply because they're a much bigger state than we are, and you have a state like Florida that is like wide open. So what is it about Wisconsin? I think their population is 6 million compared to Rhode Island.
Yeah, so it's a good question, and I felt a little bad picking on Wisconsin, but I was trying to I've gone through all the data, and what's happening there is similar. They have mandatory mask wearing. They had been on a pretty good plateau, and then they started to see small increases in percent positive, like us. And then within a matter of 3 or 4 weeks, all of a sudden they were in big trouble. So it's not a perfect analogy, and I probably could have picked many other states, but it's similar enough, and I don't want to go down that path. Basically, my message is, and this is me, this is my decision. I know enough now in this data, I know the road we're going down, and I want to take a turn and avoid where we're going. And as I looked through Wisconsin, it felt pretty analogous.
In regards to Massachusetts, have you spoken to Governor Baker? Do we remain on their travel ban?
Unfortunately, we do, which is a disappointment. By the way, they fail their own test. They would be on their own travel test. They'd be on their own travel list. Thus far, I could not get him to budge. By the way, they're starting to go up the curve. Connecticut, I talked to the governor of Connecticut yesterday. They're having this doubling of hospitalizations. They're at 2.5% positive. So I'm trying, but I have not succeeded.
Have you spoken to Governor Baker since we learned an intruder got into his home? And then we've also heard about 2 Democrat governors, the governor of Michigan and also Virginia, that were then threatened in some way. Have you?
I haven't talked to him about it, no. It's an anxious time for governors, though. I mean, there's a lot of chatter among us.
Governor, you were really adamant that students should be in school. Obviously, you set October 13th as the expectation. That hasn't come to fruition. Providence and Central Falls, as you mentioned, still have to stay hybrid. What's your response to that expectation not becoming a reality?
Well, I think maybe I misheard you. So a month ago, we said we would evaluate this week, and by and large, you know, most districts are back in person. I suppose it would have been nice if we could have said Central Falls and Providence, you also can go back full in person, but in light of everything we're talking about here, it just felt like they ought to stay where they are and continue to operate where they are. It just felt like the cautious thing to do.
One last question for Dr. Nicole Alexander-Scott. The 4 bars that were closed, one of them was issued an immediate compliance order from violations that were found 6 days prior. If it was such an immediate threat to the public there for the violations they received, why wait 6 days to tell them they must close and remedy these issues?
Yeah, we worked with them immediately to respond to and correct the issues that were at hand, and without seeing those improvements, we moved forward to the ICO. Given these conversations, we're absolutely going to make sure that that happens even quicker going forward, knowing how critical it is. We give the businesses the opportunity and then have to make sure that they're facing the consequences if we don't see the change needed.
Doctor, can I just follow up on her question of if you were the governor of the piece, Professor Emily Oster of Brown University in the Atlantic, that schools are not the super spreaders. The governor's nodding her head, so either one, but not the super spreaders that we believed they were going to be. And does that impact your guidance to the Rhode Island school system?
Yeah, it allows us to continue forward the way we have been saying. The systems are working. The schools are doing a good job. Providence and Central Falls, we were able to say there isn't a need to restrict further because they have done a good job in keeping the cases contained, in working closely with us to respond in getting people quarantined when they need to or isolated and otherwise. So our understanding of how transmission occurs and the fact that schools are not the place where super spreading can occur, along with knowing that the systems are in place. We're far ahead as a state in having the K through 12 testing system that's set up and allows for that rapid turnaround. Our ability to have the partnership with the Department of Education and the Education Operations Center, and an amazing team of heroes to me in our COVID unit, EpiOps, working tirelessly late into the night to make sure that people are called and they get the information. All of that comes together to say in-person learning is where we need to continue to push for our schools, and the article that you referenced only helps reinforce that.
And just quickly, in that article, Professor Oster mentions that for low-income children, it's irreparable damage being done. And the governor mentioned, you have Pawtucket that is complete distance learning.
Absolutely. And we can only reiterate what the governor called out to Pawtucket, to get in line with what all the other districts have figured out, and knowing that it's critical for our children across the board, from every community, in particular for those communities that historically have had less resources available to them that they need. We need to make sure that we give those kids the fighting chance that they deserve, that the families deserve, and we're doing everything at the state level to ensure the safety for teachers, for families, and the students to make that happen.
If the doctor, I'm sorry.
I did read the piece, and I'm familiar with her work. The piece was great, and yet the answer is yes, it is impacting my thinking, because we're trying to be just data fact-based. So she looks at the data, and she's a, I guess, statistician, economist, and concludes that there's no evidence to suggest spread in K-12. There are other studies, which we've read, you probably have too, we can share them with you, that look worldwide at K-12. And there's actually no evidence worldwide of real spread in K-12. So when you weigh that against the fact that children could be irreparably harmed, although these things are really tough calls, on balance, we got to get the kids in school. And as I already said about Pawtucket, it's a poor community. Parents have to work. Kids are stuck at home alone. And so that's why I have felt the way I felt. By the way, we've seen about as many cases of kids with coronavirus who are learning virtually as the kids in schools. So it's not like letting the kids learn from home is the answer, because it's roughly 50-50.
Just because at the end of August, I mean, we all watched the protests, the teachers making out their wills, the driving around, and her article in the Atlantic, none of that has proven to be true.
Correct. Thank God, by the way. I'm really happy. I mean, teachers are working really hard.
Governor, I mean, you still have teachers who are openly complaining that you're putting teachers at risk and students as well, despite all of that. They're listening to what you're saying and say it's not true. They look at any cases in schools, hundreds of cases in schools, cases in more than 100 schools, as a problem. Yeah. Why don't you see it that way?
So first of all, listen, I feel for teachers. It's really hard. It's always hard to be a teacher. It is really hard to be doing it right now. And they're doing a great job. By and large, they're showing up every day, working under difficult circumstances, being creative, and getting it done for our kids. Having said that, I mean, look, everybody's been, it's hard to be a bus driver. It's hard to be a police officer. It's hard to be a nurse. It's hard to be a CNA in a nursing home. So we're doing everything in Providence. You know, we have a custodian on every floor of every elementary school, cleaning regularly. We're offering the testing. We're requiring children to wear masks, which was asked of us by the teachers. So I hear you. I hear them. I don't want to diminish the concerns, and we're going to try even harder to meet their needs. But just like, look at the facts. There is no widespread spread, and the kids who are at home learning are getting sick at the same rate, actually at a higher rate.
I asked this a few weeks ago, Dr. Alexander-Scott, who is getting hospitalized? Are you seeing any of that among school-age kids or college kids yet? I know that wasn't the case before, because you also mentioned that nursing homes and congregate care settings have not been as much of a problem. Where are the hospitalizations and now the rising number of deaths coming from? Are those people who just got together with family members?
No, we are not seeing significant hospitalizations in K through 12. Nothing has persisted. Within our colleges and universities, there were 2 hospitalizations for sort of routine consequences. People went home within 24 to 48 hours. Unfortunately, what's happening with the hospitalizations is what you anticipate with COVID-19. When there is increased spread throughout the community, you have the same population of people who have underlying illnesses or who are older, more frail, elderly, who are at risk of developing complications of COVID-19 that require hospitalization. They end up also being in the hospital longer, the recovery time takes longer, so that's what's leading to the slow increase in hospitalizations, and that's exactly what we can put a stop to by people masking in their more familiar environments, in addition to the masking in the public settings that we all need to make sure we're doing better.
And Governor, sorry, just one more thing on the schools. We've been asking, I know you got asked this about buses a couple weeks ago. What do you tell people who are in classrooms who the windows are going to be open? It's getting colder now. Just bundle up, or what's the plan?
Yeah, for now.
Governor, I just got a message.
Could you just answer that at the podium, Governor?
Yes, for now, the answer is bundle up, because we know it's safer, and we know that's the best thing, and we're in the process of purchasing HEPA filters and air purifiers, and we hope that we have a better answer in December.
Yeah,
Would you call it?
thank you. I have a question I think best answered by the doctor. I'm interested in, you said that you and the governor met with Dr. Birx, and there was discussion earlier, I think it was from the governor, about the distinction between controlled and uncontrolled environments. That is, a controlled environment is something like a school or a workplace where you can screen people coming in, and an uncontrolled environment would be something like a family gathering. And interesting, I wrote an article about that on motifright.com a couple of weeks ago, trying to explain the distinction as to what happens in terms of prevalence. And so that's all driven by the prevalence. How common is the infection in those populations? And so the goal in a controlled environment by pre-screening people is to keep the prevalence down, to keep the number of infected people, the percentage of infected people, much lower in the controlled environment than in the uncontrolled environment. But that leads to the question, what is the prevalence? And I think we don't know that, is what I'm hearing. And in fact, that Dr. Birx was expressing concern that we need to do more testing and measurement to try to extrapolate or determine what the prevalence is. And so what is the Department of Health's view at this point of what the prevalence is? I mean, obviously you can make guesses based on positivity of testing and so on, but if the CDC is right and their best guess is that 40% of total infections are asymptomatic, that would drive your estimate. So what are you seeing? How close do you think that is? How many people out there are asymptomatic and don't know to isolate, or don't even have symptoms significant enough to make them think that they have an infection? And what can the state do to at least try to narrow down that number?
What we're doing to identify prevalence is picking subpopulations of people to get the type of asymptomatic testing that will allow us to at least understand what's happening within that community. That's been a key component of our response with the institutes of higher ed. We know that there had been an increase in cases. Very quickly, as a part of our outbreak management, do a full point prevalence testing schema of the particular student body, understand where the people who don't have symptoms are transmitting COVID-19, get them into isolation, and any of the people who are around them quarantined. That's the most effective way for us to wrap our hands around this. A big piece of what we'll be bringing back to everyone is how we can continue to get those targeted point prevalence assessments of certain parts of the population. We need unlimited resources to be able to test the entire population on a weekly basis. And so we're taking the expertise, the data, and the science to help inform where are the best ways for us to capture an understanding among the 20, 30, 40-year-olds that tend to have a higher proportion of them who are asymptomatic, allow us to identify those people who don't have symptoms, get them into isolation, and the people quarantined.
Well, no one is suggesting, of course, that it would be reasonable to test everybody on a weekly basis in the entire state. But from a statistical sampling point of view, you must have some idea of a number. At this point, what is the prevalence? Do you at least have a range?
Yeah, we are calculating that. We're basing it on what the CDC has suggested as well. And I'll reserve that. We'll come back to you with what our latest estimates are as we're making the shift in the updated asymptomatic testing approach.
Test results for
real-time question.
people,
I just got a
what their
message from a
percent
member of
positives and
General
negatives are in total
Assembly
tested.
So
I just got a message from a current member of the General Assembly governor that said they refused to cancel their Halloween party and their Thanksgiving plans. So how do you enforce all this stuff that you're saying if a seated member of the House of Representatives is saying publicly they refuse?
Who?
This is Representative David Place.
I'm going to have to give him a call. Again, you're going to get me again tomorrow, so I'll be back tomorrow at 1. I'm going to go through all the new restrictions and all the new enforcements. By the way, we're still working on it, which is why I need another day to get to it. But as a leader, he ought to do the right thing, because if he cares about the businesses and small businesses in his community, then this is the right thing to do, because if we don't, then we're going to have to shut down businesses, and like, why would he want to be part of that? But give me a day, and I'll give you all the details. Paul.
Doctor, can you get us, and I don't mean right this minute, of course, but breakdown of testing data, positive, negative, total test, percent positive, further broken down between symptomatic and asymptomatic patients?
yeah, so we have an excellent data dashboard, the Rhode Island Department of Health, that I want people to check out because it allows us to help understand. I'm going to make sure that you connect with Joseph afterwards so that we can dig a little bit deeper of what's available for asymptomatic versus symptomatic. We primarily have it in those populations of groups that I referenced, whether K through 12 or colleges and universities or congregate settings.
Thank you.
Thank you.
Thank you,